Good evening, everyone. Uh, After much criticism and just listening to everybody's comments, I've decided to change my research question. Uh, Now I want to be focused on AI's effect in preventable healthcare, as in now AI is being used to be able to detect cancer growth, tumors, been able to make healthcare diagnosis for patients in a clinical setting. It's not yet to the point where it can be used for, differential diagnoses like multiple diseases at once or one disease causing another disease. But AI is still pretty fresh, and now it's the prime time as it's being introduced into healthcare. And just my question is how accurate are these diagnoses that AI give patients, and what's the success rate and these cases where it's been able to detect cancer or another disease uh, or other comorbidity that's in a patient just by having the lab results and the EMR and it being able to filter through the patient's chart and numbers and test results and be able to see something that a physician might not be able to see. Some ways I'd like to see if you can measure this is patients that have discovered a diagnosis or cancer diagnosis through AI is the how early of a diagnosis was this compared to somebody else with the same cancer that was not caught using AI. As you know, with anything like cancer, the quicker you detect it, the quicker you can start treatment and the higher percentage of that you can beat the disease. So just to see, just kind of get a number of how early it can be detected by AI and the percent of survival rate for people that who had their cancer detected through AI versus someone who didn't find out as soon due to just being a late diagnosis. I think AI is going to change healthcare. It's going to help out our primary providers and mid-level providers and being able to help sort through patients with relative easy diagnosis. That way we can focus on patients with more extreme comorbidities and chances of ICU stay and ventilator stay. I think as time goes on, as we gather more information using informatics and collecting patient data, it's only going to make AI stronger and better at being able to diagnose patients. And it's going to be my new research question. And like I said, collecting data through the patient's EMR and just comparing patients that have been diagnosed or been treated with AI diagnosis compared to patients with a traditional diagnosis on just recovery rate, diagnosis time, and just the outcome of their treatment. And that's it, folks. Thank you.